Hi, everyone.
My name is Rahul Banerjee from the Fred Hutchinson Cancer Center in Seattle, Washington, and thanks for joining us for another issue of the Hem/Onc Pulse. Today, it is my pleasure to be joined by Dr. Francine Foss to speak about T-cell lymphomas. Dr. Francine Foss is a professor of medicine and dermatology at the Yale School of Medicine and is a world expert in T-cell malignancies, cutaneous lymphomas, and so forth.
Every story has a pulse. Let's check the vital signs of what's happening right now.
Dr. Foss, Francine, if I may, pleasure to have you.
Thank you very much, Raul. It's a pleasure to be here.
Wonderful. We're recording this podcast in January 2026, about a month after the ASH meeting. On either side of ASH, I always ask people, what are you excited about, or what happened that you were excited about? Anything that stood out in the world of T-cell lymphomas, T-cell malignancies in general, that you thought was interesting or worth disseminating to the broader hem/onc audience?
I think one of the major things that's happening in T-cell lymphoma, there are two major things. We're moving away from the so-called wastebasket category with T-cell lymphomas, with PTCL NOS, for instance. We're now using molecular techniques to identify different subsets. And this, of course, is really critical because we also have a number of pathway-directed drugs that are available to us today and in development. So we're really trying to now hone in on what the mutations are for the individual patient and how we can subclass these diseases better. The ultimate goal, of course, is to improve our upfront therapy, which still really hasn't improved much since we completed the Echelon 2 trial, which was our last really major big accomplishment in T-cell lymphoma.
And so it sounds like it's not just about CD30 or not on the outside. You're talking like genomically, like sequence these cells, look for driver mutations, and targeted therapies is the way forward.
Exactly.
Is kind of what you're alluding to?
Yes, I am. And I just want to point out that if you'll notice, if you refer to the NCCN classifications for these diseases, we've identified the follicular helper subtype as a distinct entity. And that's critical because we know that epigenetic therapies such as HDAC inhibitors and more recently IDH1, IDH2 inhibitors are particularly effective in this group of patients.